I'll wash my hands, wear PPE. I'll introduce myself to the patient. I'm going to ask for the two patient identifiers, the name and the date of birth, and confirm it with the ID band. I'll explain the purpose of taking the health history and physical assessment procedures to the patient and close the doors to maintain privacy and confidentiality. I will also gather the equipments needed like the stethoscope and sanitize it. Hello, Michael. What brought you today in the hospital?
I'm here because I'm experiencing a crushing pain on my chest.
Oh, I'm sorry to hear that. What makes it worse and what makes it better?
Uh, Shoveling the snow and nothing makes it better or worse.
I see. So, what does it feel like right now?
Feels like crushing pain.
Can you tell me where do you feel it? Is it radiating anywhere?
It's mainly in the chest but also radiates down my left arm.
Can you rate the pain from 0 to 10, as 0 as the no pain and 10 is the severe pain?
8 out of 10 for pain.
When did it start and how long does it last? How often does it happen?
Pain started after I shoveled the driveway this morning. I've never had a pain like this before.
What do you think it means?
You wonder if you're having a heart attack.
Oh, so do you have trouble breathing?
No trouble breathing.
How about when you're lying down?
No trouble breathing when lying down.
Do you have any cough?
No cough.
How do you feel right now generally?
Feel very tired right now. My spouse had to help me get into the car and to the hospital.
I see.
I feel like I feel very pale.
Yes, you look pale, but let me see your mouth. I don't see any bluish discoloration around your mouth and your lips. Your leg is no edema. Do you have trouble urinating?
No.
Do you have any conditions or problems with your heart before?
I have high cholesterol for 5 years.
Do you have any parent or siblings that have a heart problem?
My father had MI at age 56.
I see.
And my family has a history of heart attacks and hyperlipidemia.
Do you smoke or do you drink alcoholic beverages?
I've never smoked. I drink 1 glass of red wine every week.
Do you experience pain in your legs?
No leg pains or cramps.
Do you have any skin changes for the last few days, weeks, or months?
No skin changes.
Oh, that's good. Do you take any prescribed medications, over the counter drugs, recreational drugs, or herbal supplements?
I take Isotrol for high cholesterol and the vitamin D as well.
Okay. Do you have any allergies?
I'm allergic to bees.
Oh, I see. Okay, Michael, I need you to sit down in bed and take off your shirt so that I can hear your heart sounds clearly. So now using the stethoscope, the diaphragm of the stethoscope, I'm gonna auscultate the heart sounds. First, I'm gonna locate the sternal notch. Now first auscultate the aortic valve located in the right sternal border in the second intercostal space. S2 is heard louder at this area. Next, I'm gonna auscultate the pulmonic valve located in the left sternal border in the second intercostal space. S2 is heard louder in this area. Then I'm gonna auscultate the tricuspid valve at the left sternal border in the fourth intercostal space. Where S1 is heard louder in this spot. Lastly, I'll auscultate the mitral valve at the mid-clavicular line of the right sternal border in the fifth intercostal space. S1 is louder in this area. I will switch now to the bell of the stethoscope and auscultate for swishing and blowing sounds. I don't hear any swishing and blowing sounds. Now, I'm gonna locate again the left midclavicular area line and the fifth intercostal space to palpate the apical pulse for rate and rhythm. I'm also gonna use the diaphragm of the stethoscope to auscultate the apical pulse and count for 1 full minute. Normal should be 60 to 100 beats per minute. After 1 minute, his apical pulse is 61. Now I'm going to inspect the chest for any abnormalities. Next, we will turn the patient a little toward the left side to palpate for the apical pulse, which is located 1 to 2 cm at the fifth intercostal space midclavicular. Using my warm hand, I'm now gonna palpate the base and the apex and the left sternal border for any heaves and lifts. I don't feel any rushing vibrations called thrills. I'll now go back to the apical pulse located in the midclavicular line in the fifth intercostal space and check for the apical pulse and compare it to the carotid pulse. Both are synchronous. All right, Michael, you can put on your shirt now. And thank you for your cooperation. Please wait for the doctor so that he can check on you as well.
Thank you.